Developmental dysplasia of the hip, DDH, in 5 minutes. Developmental dysplasia of the hip, or DDH. Very important to know it by heart. You cannot miss the diagnosis of DDH. DDH ranges from complete dislocation of the hip joint, means that the femoral head is outside the acetabulum, to dysplasia of the acetabulum, which is a shallow acetabulum. Risk factors of DDH: breech positioning in utero or breech presentation, especially in the third trimester, female sex, being firstborn, positive family history. Very important to ask about family history of DDH. Other conditions related to prenatal positioning or breech presentation or narrowed uterus, metatarsus adductus and torticollis are commonly associated with DDH. Another important risk factor is improper swaddling. Improper swaddling can cause DDH. Diagnosis of DDH in neonatal period: very important to do screening from birth and in each subsequent well visit using Barlow and Ortolani, either with or without risk factors. So it is mandatory for all pediatricians to do Barlow and Ortolani for all newborn in the hospital after discharge and in each subsequent well visit. If you suspect a case of DDH, order hip ultrasound if the age less than 4 months. From 4 to 6 months and ideally from 6 months, plain radiographs will make the diagnosis as well. Will show the dislocation and dysplasia. The best screening method for DDH is Barlow and Ortolani maneuvers during neonatal period up to 2 to 3 months. After 3 months, it will be difficult to do that. So you hold the thigh in this position, the thumb is inside and the 4 fingers outside over the greater trochanter. You hold the thigh gently, don't apply too much pressure, and you hold the thigh into the position of adduction, and you apply gentle anterior pressure. Barlow will try to dislocate the head of the femur out from the socket of the hip joint. If it's positive, you will feel a clunk and you will feel the head of the femur coming out. And Ortolani afterward, you do Ortolani after, and you hold the thigh in abduction position. And in this case, you are trying to relocate the head of the femur into the socket of the hip joint. If you feel the clunk and you feel the head of the femur is returning back and is easy, this is positive. This is a case of developmental dysplasia of the hip. If Barlow's and Ortolani maneuvers are positive, refer to a pediatric orthopedic. So you do not need to order an ultrasound. Positive exam is enough to refer the infant. This is AP pelvis radiograph for a 14-month-old girl with developmental dysplasia of the left hip. If we look at the ossific center on the left side is much smaller than the ossific center on the right side. This is the left, this is the right. And if we look at the Helgen-Reiner line is drawn in the inferior portion of the iliac bone on both sides, and Perkin lines is perpendicular crossing the acetabular roof. And here you will see the location is different than here. So on the left side, the ossific center is located in the upper lateral quadrant, while the ossific center on the right side is located in the lower medial quadrant. This is a case of DDH on the left side. Diagnosis of DDH or clinical presentation of DDH: positive Barlow and Ortolani in the first 3 months of life. In older children, when they start to walk, they will present with limping if it's unilateral, or waddling gait if it's bilateral. Limb length discrepancy is one of the manifestations, and the dislocated side will be the shorter side, with limited abduction of the affected side. Limb length discrepancy or unequal limbs can be detected by Galeazzi sign. Very important to be able to perform this exam, Galeazzi sign, by flexing both hips and knees on a flat table. And you look at or you compare the knee height in both legs on the right side or on the left side. If you look at this positive case, this is normal, so the right side is normal, and this child is having shorter, the knee is below the other one than the right side, so this is a case of DDH on the left side. DDH screening by ultrasound at 4 to 6 weeks. If you have a breech position in the third trimester, so this is a risk factor, but the exam is normal. In this case, order a pelvis ultrasound at 4 weeks of age. Ordering earlier than that, like after birth, will give you false positive result. Is a risk to have false positive result. So it is important to wait 4 weeks, then you order the ultrasound. Family history of DDH, also order, and your exam is still negative, order ultrasound at 4 weeks. History of abnormal hip physical examination in the neonatal period. History of improper swaddling, you can order at 4 weeks, also your exam is still negative. Suspicious or inconclusive physical examination, you are not sure about the physical examination, you can order also ultrasound at 4 weeks. Treatment of DDH. Orthopedic referral for pelvic harness for infants less than 6 months. Pelvic harness will be worn for 24 hours a day, and the parents are able to change the diaper while wearing the harness. For how long to wear it for? For 6 to 12 weeks. Closed reduction and casting for children 6 to 18 months with DDH. Open reduction for children more than 18 months with DDH. This is the end. Thank you.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.